Thank you so much. That was fantastic. I'm so inspired by the work that you all are doing. We will hold off on questions until we've gotten through all three presentations. Thank you so much. My pleasure to now introduce our next speaker, Alana Price, who is a NICU nurse at St. Joe's, and she's been there for over 30 years. I just learned that.
And I don't think that's true because I started when I was 12.
Like 12, yeah, exactly. You started at a very young age. And Alana's been involved with Define from its inception. She's also been involved in family integrated care when it first rolled out at St. Joe's. And I just can't say enough about their Fight Care program at St. Joe's. If you ever have an opportunity to do a site visit and take a visit to St. Joe's, it is quite remarkable to witness a parent lead rounds and parents then determine what the next step should be for their baby. It is phenomenal. So thank you, Alana, for joining us again.
Thank you. So I'm going to talk about just our work with family engagement at St. Joe's, including our family integrated care, our automatic rounding that we do with the families and our care conferences, and then our safe sleep initiatives. Oh, I just said all that. So again, Susan already introduced me. I've been at St. Joe's for maybe 30 years. I truly believe in my families. I love advocating for my patients. My goal is to teach the families to succeed and feel comfortable taking care of their babies when they go home. Our unit is a 52-bed unit, level 3B, average daily census 35. We go up and down, obviously. 7,000 deliveries a year, 70 to 100 small babies. We now resuscitate up to 22 weeks and above. We are members of the Vermont Oxford Network, and we all private rooms. We have a couple 8 twin rooms that we will put either siblings in, or we have shared rooms with other families. So we started FIC around 2017. And again, our goal was to help improve the family's readiness for discharge and feeling comfortable taking their babies home. When we initially did the website, it was a lot of information, probably a little bit more than the families needed. We had one pilot family that helped us navigate it, and they loved all the extra information that was on it. I would say most of our families found it too overwhelming. So with that in mind, we did, over the next several years, we did go ahead and simplify the process. There were multiple quizzes, like pretty much every care aspect that you did with your baby, there was a quiz related to that. And now we just have basic quizzes that are needed for safety purposes, like the crib. You need to know to lock it because you don't want to leave it down so that a baby doesn't fall. The feeding pump, we have our families go ahead and hook the pumps up, start them, connect them to the NG tube, make sure they're at the right placement. So obviously that is a safety issue as well. When we started, our staff, I think, felt a little bit taken back. They really felt like this was going to take away their role as a nurse. And really the goal of this was to walk alongside families and help empower them to be their baby's caregiver. So I think the struggles that we're having now is we have seen a fair bit of turnover in our unit. And so getting like our new staff up to speed on completing the quizzes themselves, going through the website themselves. We do have a lot of travelers, again, just making it a priority. We do have the website available in both English and Spanish, which has been great. When we're talking about communication with this whole family integrated care, our goal is to have effective communication with the family. Over the past several years, we've instituted our discharge navigators, or Jen and I were just talking, what did we call it? Care navigators. And so they play a huge role in welcoming our families to the unit, introducing them to FIC, to some of our support groups like Love for Lily. They will discuss primary care nursing with the families and kind of help them navigate their way around the unit. They play a key role in communication with our families. For our small babies, less than 1,500 grams, this is where our care conferences come into play. So usually by day 2 to 4, our physicians or our NNP team, whoever has those babies, will communicate with them regarding a care conference. We usually do that by the end of the first week of life. And that is, that does the entire multidisciplinary team, including the doctor, the NNP, the bedside, or the primary nurse, the charge nurse, the social worker, the chaplain is now involved, and any other family that they want to be at the care conference. So we hold the care conference we have a conference room, so it's kind of away from the baby's bedside. It's a closed door, so if they need to bring their siblings or whatever, they are welcome. We do have a template that we use for our care conferences that has doc phrases that I'll go into on the next couple of slides. They're super quick. The families are encouraged to bring anybody that they like, and of course the questions. When we first talk about it, the families, as a nurse, we try to say this shouldn't be a scary meeting. This is just a general overview of your baby's stay and kind of things to look for. We don't always have a second care conference, but knowing that the family can recommend one at any time and ask for another one. So we do an overview of all of the systems, kind of what has happened so far, what things that they can expect, eye exams, head ultrasounds, vaccines, anything that the parents would like to discuss, and if they're any of the results. So this is just what the care conference template looks like in Epic. So I have it over, I think, 4 slides. It just shows the gestational age, where they're at today, if there's a language barrier. The stars are just the dot phrases. So if you click on that, you can just type in, and you don't have to answer all of these questions. Like, we just go through if there's anything to be said about the neurological system. If we've done a care conference or a head ultrasound, we'll add it in there. Lactation support, what their thoughts are on vaccines, discharge planning. So on our super small babies, we don't highlight this at the beginning, but it's in there if we have a little bit of an older baby. And then this last template for the care conference is family communication. So again, we introduce the family integrated care. If they have any questions or concerns, if they've picked a primary nurse, we explain that to them and just allow them to ask any questions. And then for our safe sleep guidelines, so we start preparing our families for safe sleep probably around 32 to 35 weeks. By 35 weeks, if a kiddo is medically stable without any respiratory support or IVs or an isolate or anything like that, we like to have them in safe sleep. Our hospital is safe sleep certified through Kids for Cribs for Kids. Other way around. And so this is the documentation that we have. So these are the handouts that we give to our families. So and we have them in English and Spanish, and it's pretty specific as to what's in the bed, what's not in the bed. These are new. We are now Intermountain Health, and so we have some different signage that is happening. And so this again is in English and Spanish, and these are put up on the isolettes, on the sidewall, anywhere near the baby, and we are getting them out at 32 weeks so that the families know as the baby progresses, we will be taking away some of their developmental aids. And then again, by 35 weeks, we then will take the rest of the developmental aids out and flip the card over to that second side to where it is the ready for safe sleep environment. These are hanging on the walls in our room. So we have both the family integrated care, which the families kind of will navigate through the balloons, and then they earn the badges. And then the building blocks to home, just ways so that the family is aware of how much progress they are making in their steps to go home. I would say that most of our early babies are encouraged to do the family integrated care. One thing that is really neat is having the families present for rounds. It gives them a sense of ownership on their baby, or, you know, they can tell us what's going on and how they view their care and how things are going. We have a little template that we give our families so that they can, you know, my baby is this many days old, they weigh this much, this is what they gained last night, this is their respiratory support, this is how they're feeding, any concerns, and then the physician team will then add to anything. So, but our goal is through the use of our family integrated care and good communication is to have parents feel ready for discharge when the time comes. Mine was fast.
Thank you. No matter how many times I've heard this, I just love it every time. Bike care at St. Joe's is awesome.